Hello, my name is Dan Hankley. I'm a physiatrist. I work primarily in the Arden office. I am board certified in physical medicine rehabilitation, and then I'm fellowship trained in interventional spine medicine, which basically means I do spinal injections for people with neck and back problems. One of the reasons I sort of gravitated toward the field of physical medicine rehabilitation was just the importance it placed on improving the functional status of patients. I became interested in being a doctor at a very young age. There was really nothing else I wanted to do. I was very fortunate to have a family friend who was also a family physician where I grew up in Memphis, Tennessee, and was able to shadow him, and he demonstrated the ability to just perform very compassionate care to his patients, and I think at that point I really realized that's the direction I wanted to go as far as being in a profession where I could help other people. So my favorite part of being here at EmergeOrtho are the patients and the staff. The patients, it's very rewarding as a physician to see people improve, and I commonly see people with neck and back issues, like I said, whether it's our older patients with arthritis and spinal stenosis, which limits their ability to walk, or some of our younger athletes who just want to get back into their sport. And it's nice to be able to see them develop a plan and hopefully lessen their pain and allow them to get back to their activity, whether that's getting back to their sport or walking to the mailbox without pain. And the staff that we have here is wonderful, all the way from our administrative staff to the staff that I work with on an everyday basis. We put patients first, makes it a joy to come into work, and I work closely with the medical assistants and the x-ray staff that help me on a daily basis, and could not do the job that I do without their assistance. One thing that's very unique about EmergeOrtho is we are the largest practice, orthopedic practice in the state. It was formed by several smaller practices who had a similar vision. And being such a large practice allows us to stay independent. We're not under the direction of a hospital system, for instance, which is nice because it allows us to provide higher quality, low-cost care and put the patient first. For instance, I do a lot of spinal injections for people with back and neck pain, and we have an office procedure suite that we can use, whereas before we would have to do those at the surgery center that's hospital-based, and the cost was significant compared to what we can offer for patients now. It's also nice to have colleagues who have trained from different parts all over the country and then decide to move here for reasons, lifestyle, or the medical center that we have. And so we have the ability to bounce ideas off of colleagues, and if we have difficult cases, we can always have somebody that we can discuss that with. And situations where we need to have the spine surgeons get involved with our patients, we have excellent choices, and they provide excellent compassionate care. My patient care philosophy is pretty simple. I put the patients first. I try to listen to what they want, their goals. I work closely with our staff, including our physical therapist, to try to develop a plan to reach those goals, whether it's an injection to lessen their back pain, some rehabilitation to help them through their particular situation to get them back to their activity that they want to do, and just try to treat the patient as a person with a holistic care. I've been with this practice for 24 years now. Just came here right out of fellowship. I've had the opportunity to develop some long-term relationships with some of our patients, and it's been rewarding to see them out and about in the community, whether it's at Mink Creek while I'm mountain biking or just hiking on a trail. And it's rewarding to see them to be able to get back to their activity without the pain that was hindering them. It's also rewarding to have some of our older patients refer some of the new patients to us as well, and that's a common thing that we'll see, that so-and-so, is on my bridge club and she said you were great or whatever, and so it's rewarding that I've been here for the length of time just to have that. So when I'm outside of work, I have a wife and 4 kids and one grandson who's almost 2. So a lot of my time is spent with family. My wife and I both like to stay active as much as we can. We like to hike and mountain bike and those sorts of things. So we try to stay outdoors as much as we can and enjoy this weather that we have in Western North Carolina.